Hey there, and welcome. I'm Anna Hartman, and this is Unreal Results, a podcast where I help you get better outcomes and gain the confidence that you can help anyone, even the most complex cases. Join me as I teach about the influence of the visceral organs and the nervous system on movement, pain, and injuries, all while shifting the paradigm of what whole body assessment and treatment really looks like. I'm glad you're here. Let's dive in. Hello. Welcome back to another episode of the Unreal Results podcast. I have a special episode today. I have one of my friends and colleagues and alumni from the LTAP Level 1 courses with us. Maria, she's up in Bend, Oregon area, and she learned from me, I think, a year ago.
Mm-hmm.
A year ago, and has been utilizing the LTAP in her practice. And I wanted to bring her on the podcast today and have her share about how she uses it, and then also just share about her practice, because it's a very unique practice setting that she operates in, especially for athletic trainers. And I'm all about letting people know all the options that athletic trainers have to make an impact in the industry. So I'm excited to have her. Without further ado, welcome, Maria. Thanks for joining us.
Hey, Anna. Thanks for the invite. Great to be here. So, as you said, I'm Maria DelliVeneri, certified athletic trainer since 2008. I've been working in every setting that athletic trainers could possibly be in, from high school to college to Power 5. But since 2014, I switched over to the clinic side. And then most recently in 2022, my own private practice up here in Bend, Oregon.
I love that. And with your private practice, what kind of patients are you seeing most of the time?
Yeah, great question. So, as an athletic trainer, I think that's one of the biggest things I hear from colleagues of I want to work with athletes. I don't want to give up working with athletes so much. And quite honestly, that was one of my hesitations too when I switched over to be what's it going to be like working with general population? Well, if you've been to Bend or heard anything about Bend, you'll realize that these folks are athletes throughout their entire lifetime. So, well, my general population does average kind of 55 to 75. These are still the folks that are, playing pickleball 4 days a week. They're skiing 70 days a year. They're riding their bikes. They're hiking mountains. So it's not your average patient population. So with that too, with the folks that have that mentality of go, 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 you still get that excitement of working with the recreational athlete, except now rather than being at that high level of college where you're taking people that are already from here to here, you're taking people that are still, they're here and they're active, but now they have things they're 40 years older than our college athletes. They've lived life. They're retired and want to keep going, but they still have that mentality of they don't want to stop. So it's hard. I always say to them that I want to be them when I'm retired. It's really cool.
I like retiring in Bend does not sound like a bad move.
It's not. It's not. So
and mountain biking and hiking and all the things. So
right.
I love that. So when you originally found me, however you found me, I don't even know how you found me. What made you feel like the LTAP was the thing that you needed? What was the problem that you were having in your practice, or what were you hoping to gain from taking the courses?
Yeah, great question. So I actually found you way back when on some Fitcast podcast episode with Kevin Larrabee, and you were doing all your work with Mike Boyle and stuff. Way back when.
Wow.
But yeah, so
Kevin, I haven't talked to him in ages.
so that podcast, man, that got me through a job one time when I was working for the state. But needless to say, a lot of foundation to get me where I am. So how I found you, gosh, I was searching for a problem, or searching for a solution, the problem that I had. With my work since 2014, I've been specializing in using shockwave therapy and class 4 laser for regenerative medicine purposes and focusing with the older adult. So In the United States, Shockwave is still kind of in its infancy here and starting. I wouldn't call it a household name yet. People are still learning about it. So typically, when people finally stumble upon Shockwave, it's because they've tried everything else. So they've tried rounds and rounds of PT, chiro, acupuncture. They've been doctors. Maybe they finally went down the surgical route, but their pain's still there. So that's when they usually would come into my door, is something where, it's not like I rolled my ankle on Friday and I'm seeing the athletic trainer on Monday. It's kind of like I injured this thing 6 years ago, tried everything, and I'm still dealing with it. So that right there is a complex patient that tends to, as you know, just has so many layers that's with it. So with shockwave and laser, what it can do for the body and what it can do for that internal environment of where the actual pathology is really pretty remarkable. But at that time, typically with people with chronic injuries that are walking into the door, have all sorts of compensations and layers and things that come with it. So what I was trying to, or what I was really struggling with, is really getting to that point where like they're getting better, but either not all the way there, or there are people that are not responding even to shockwaves. So like, as a clinician, like you get that patient where you're like, they're banking on you to be like, you're the thing that's going to be there. And then you get the whole other layer of like, oh, it's another thing that didn't help me. So that just motivated me to be like, well, that's not going to be me. Or I'm going to try to like, how can you minimize that?
Yeah.
And so what I started picking up as I was seeing more people and people and people that I was treating is like, you pick up on the patterns that people present with and compensate with. And that actually led me down the PRI rabbit hole. So I was deep in that for, gosh, maybe about probably 4 of their courses I've taken and some of their secondary ones. But what I was finding at my last job, like at Canyon Ranch, people come for either you see them once, they might be there for a week, or they live there for a lifetime. So very small time amount that you could have to like change and make an impact on somebody. So with PRI, it could be cumbersome. I was novice enough that I could stumble through some stuff, but like I couldn't really nail it home with people with that. And so I was searching for something that like was still a neurological focus, because I could see like that is where you can really start making changes for people. But I knew that I needed something better and faster or different or more precise. And so when I started hearing your stuff online, I'm like, this seems like it's it. It's like coming from, we speak the same language as athletic trainers. We know the background of that. We know how to look at bodies that way, but it's like finding that extra layer of going through something that's assessment focused and quick to make an impact on people, combined with shockwave and laser that can do its own thing, was huge.
Yeah.
So it's like really, I guess, finding a way of like, with complex patients or the older gen pop that's really, really active, it's usually not just straightforward as what we'll see with an acute ankle sprain patient. So it's like, how do you find those layers? And that's really where the LTAP started drawing my attention and really sought me into the ecosystem with it.
Yeah. It's, as you're talking, it's interesting too, because it's like the, well, a couple of things come up. Number one, with the PRI stuff, I've gotten a handful of people come through the LTAP course, the level 1 course, that have come from a PRI background. And it's been cool to see how people overarching, no matter what background people come through to the LTAP, after they learn it, they're like, oh, it's so nice to now know where to start with all my
Mhm.
tools, which is like what I love about it, is like you don't have to throw out everything and everything that already works in order to like utilize it. It just slides right in and complements everything and like supercharges it in a sense. But it's one of those things too, and and this is, I think, what you were seeing is between the shockwave and being able to treat the nervous system and like the physiology a little bit more with that, and then also with the PRI. At the end of the day, even though people think of PRI being a lot of hamstring exercises and core stuff and breathing, like when you look at the body from a whole organism standpoint, and you start to see start to consider the viscera and the nervous system, you start to
Mhm.
see that the breathing exercises, though breathing is an important part of our stability system, it really is something that's really influencing our viscera and our nervous system. And so when you look at an exercise, well, and I will say this too, like, I know PRI goes even further down the rabbit hole of the viscera and the nervous system and
Mhm.
neurological stuff and central nervous system in their more advanced courses. So I'd also say like pigeonholing them into what most people know them as, which is like
Mhm.
core exercises and hamstring exercises and breathing exercises, is like probably unfair to Ron and all the stuff that he's created. However, that is at the end of the day still what the majority of people think it is. And I'd say the majority of people utilize it that way because they don't
Mhm.
go through the advanced courses, right? And so but it's cool because it is a modality that gets good results for people, especially for people who, failed at traditional rehabs a lot. Like there's a like
Mhm.
at the end of the day, like there's a reason PRI got really popular is because people got results with it. And so it's like y- something's not going to get popular like that unless you are getting results. And so then for me, I always think about things like that. No matter what exercise, I always tell this story in the when I'm teaching in the LTAP level 1 about like pelvic clock exercises that I used to do with my patients. I started noticing the patterns, like you were saying, the patterns in people. It's like no matter what issue they had, whether it was back pain or hip pain or knee pain, sometimes pelvic clocks just seem to be like one of the most powerful exercises for everyone. And
Mhm.
across the board, people really liked it. And it was, I always remember thinking like, what is it about the pelvic clocks that seem to universally be such a good exercise? And you can, when you know anatomy enough and you understand sort of like the biomechanics and the like core lumbopelvic control stuff, you can like bullshit your way of saying like why you think the pelvic clocks are working. But when I started learning visceral anatomy and when I started learning about the nervous system and autonomic nervous system a little bit deeper, the central nervous system a little bit deeper, there was this light bulb that went off. And I was like, now I
Mhm.
see why the pelvic clock exercises were so powerful, is because I was treating the viscera, I
Mhm.
was treating the autonomic nervous system, I was treating the central nervous system. So it was a really high payoff exercise in that standpoint. And when we look at and so breathing exercises end up being like that too. It's like, yeah, they're creating stability, improving diaphragm mechanics, but when you like the diaphragm at the end of the day is the main muscle that's splinting the visceral organs when the visceral organs are not moving well. And
Mhm.
so it's like, but on the flip side, doing breathing exercises or doing mobility work around the rib cage focused on diaphragm mobility, diaphragm function, you are inherently then going to mobilize the organs. And so you're getting this added layer of doing visceral work. And and this is a big thing too that I think I really advocate for in teaching this work is, as much as I've loved going to the Barral Institute courses and I recommend them to every clinician, like at the end of the day, we've always been treating the viscera and the nervous system. We just haven't been seeing it through that lens of view. And when you can start seeing it through that lens of view, now you get to pick and choose the exercises in a different way, like because of a different reason, and they become even more powerful. So I love that you started to like question that and like realize that too. And so it's like, yeah, just like it is fitting and perfect for you because
Mhm.
it's your love. So,
Huge on that day-to-day part of it. And I think the bigger thing you bring up too is talking about the different lens to go through, because the biggest thing that I think I've really started incorporating most recently is conversations with patients of like introducing them to that lens, because like as human beings, we don't really have a great understanding of like what is pain, and like anything I have pain must be a musculoskeletal thing and it must be something I can touch and feel because that's all I know and can conceptualize. So when you can start connecting dots for patients, I think that is huge, for those experiences, and they can start feeling it in themselves and
mhm,
seeing where that comes from. Because oftentimes I find that they don't necessarily have like the words to fully vocalize or fully tell the story of what they're seeing, feeling, or how they're moving, just because they don't have another lens to come through with it. And so sometimes too, on the flip side, knowing your patient, meeting them where they're at with that part of it, like they may not have the full capabilities to sit with you and be like, oh, here's truly what a central nervous system is and what it is, and here's the viscera. But if you can come at them with a breathing exercise and they're like, oh, I know breathing, I know core stability. And so it's like you're giving them what they need, packaged at what they know, and then kind of meet them along that journey to get that outcome. So that's been really helpful too, to pick up like different ways, like you said, like choosing an exercise that has so much more power to it to have an impact, and like really knowing it's a way there that they're like, oh yeah, it's a pelvic clock. I did this in Pilates or saw this somewhere. And you're like, oh yeah, perfect. You're familiar. So they feel confident with it too, because it's not something totally radical, which again, like PRI concepts are really interwoven into a lot of this. But for a lot of people, like they really got to be on board with you, and they really got to have full trust, and they really got to like have the patience and the concentration and the dedication to execute it. Whereas like if you give them pelvic clock and they have the same outcome because you influence their nervous system and their viscera and their movement, like huge.
Yeah.
Huge.
Yeah. I love that. That's a really good point. I haven't thought about that, but I do see that. And I do think that that is like, I always tell people, you know, when they ask about my athletes and my clientele, and they're like, oh, you must, you know, like, oh, if you go to someone's team, you must see so many of the team. And I'm like, well, no, that's a very specific client that is like open to this kind of thing. But I think about how other like visceral and neural practitioners are and the treatments they do and like the setting they're in, and I'm like, yeah, some of my athletes just would not be okay with that. And it's like, yes, a lot of the times when I'm like cupping or doing and having them do an exercise or whatever I'm having them do, they just see it as a musculoskeletal exercise, but I am giving it to them for like a very deeper, literally deeper reason of targeting the nervous system or targeting the visceral organs. And, you know, so it's just, it is, I love that you said that, because I'm like, yeah, I didn't even really think about that as utilizing this lens of view with old exercises that people are familiar with. It's already predictable to their brain. It helps them feel safe. It truly is a way of meeting them where they're at, which is just, I mean, that is one of the core beliefs, like principles, the osteopathic principles that we operate, you know, at the LTAP and with the treatment, is like meeting the body where it's at is so important, and not forcing it. Right. And so I love it. Like you nailed it. Like that. It is so nice to be able to like speak, even though we know we're not operating that sole musculoskeletal biomechanical lens anymore, that model anymore. Like we can still package it in that model so it makes sense to the athlete, it makes sense to the person. Because yeah, at the end of the day, the more famous part of the body when somebody's coming for rehab or body work is they think everything is their muscles and their joints. And that's fair. Like it's fair too, because it's like that's how we're designed. The musculoskeletal system is the bodyguard to the most important things. And so yeah, our pain is going to manifest in our musculoskeletal system because that's its job. And so it's like, yeah, what purpose would it serve of telling the person, like, I get it, explaining them to understand where pain comes from in the brain is valuable for them to understand why sometimes pain can be challenging to get rid of, but also like they're like, well, okay, but my shoulder still hurts.
Yep.
I get it from my
1,000%.
brain. Yeah, I get it from my brain, but my shoulder, like this hurts. So
And it
it's
hurts
like,
now.
yeah. So I'm like, it's almost like forcing, like you're forcing them to try to understand it from a scientific level, and they're not scientists, and they don't care. They just don't want it to hurt anymore. And so it's like, no, your job's actually to get them to not hurt anymore. Maybe educating them on it will be helpful, and is it a part of it? But a lot of the times there's a lot of other tools that you can use.
Oh, for sure.
Yeah.
Because I mean, that's just like one of the biggest struggles that we have, right? In orthopedics, is just this concept around pain. Like pain's not fun and it's not a great experience. Like, and so when you're trying to tell a patient like, oh, it's necessary, your body's doing its job, that means that your body's doing something great. it's still back to that part of like, yeah, but it sucks to live in this
Yeah.
body. That hurts.
It's literally like gaslighting people.
Mm,
Yeah. I'm
yeah,
like, "What? Why would
yeah,
we do that?" Oh my
yeah,
god.
yeah, yeah. Which is like a whole other bigger conversation, right?
Yeah.
But,
Yeah, it
but,
is.
and I think that's just the reality of that aspect of it. So, like, especially again, when I get those complex patients that again have tried everything, but they still have pain, like you're dealing with a lot of stuff. So not only like the physical presentation of these humans, but also looking at like those thoughts and beliefs and experiences that they've had, you know? So that's really where it is important. If you can have something that can be effective and it's fast, because again, like shockwave and laser, we're remodeling and regenerating tissue in an internal environment. So like we're still playing the long play here.
Yeah.
Like don't get me wrong, like we can get some acute hyperanalgesia, we can get
Yeah.
something where sometimes people will feel better pretty quick, but like we're still waiting kind of, 6 to 8 weeks post the last treatment to really get the ball moving on that tissue from an internal environment. So like
Yeah.
how I really share with people is that, like, yes, these modalities can have a time and a place to truly improve that environment, and we're doing that. But like in the meantime, let's work on you as the human and like just optimize every bit of that movement. And so, like having that lens, and coming from the LTAP, like it's radically changed every bit of my approach to patients and patient care. Cause like now I have another way that's like fast, it's effective, and it like puts a name in my head to what I've been seeing for a long period of time
Mhm.
and having to work for it. Cause like
I could
similar. Oh,
imagine too, sorry, I could imagine too, knowing that Shockwave's a little bit of that long game when you are trying
mhm,
to remodel the tissues and change the physiology. Um, I can imagine that when you have a tool like the LTAP and can concurrently take away their pain very fast and change their mobility or like their strength very quickly, then there's
mhm,
more buy-in to continue to return for that shockwave over the next 6 to 8 weeks or whatever it may be.
mhm.
As opposed to like if you just were using shockwave, like and don't get lucky and get a pain decrease the first couple sessions, they're like, "I don't know, I don't really feel a difference," because you might not until the tissue can change.
Yep. Oh, huge, huge. I actually had that conversation with a patient today because having like torn meniscus on top of arthritis in her knee and kind of having this expectation of, she had PRP 3 weeks ago and she was like, I don't think I'm getting better. I don't think it worked. I don't think all this stuff. It's because again, like not only as humans do we not really know about pain, but we also don't know like a healing physiological timeline and like what's actually possible within the body and like what can we truly like speed up and support versus like what is truly going to take
Mhm,
time.
mhm,
um, and so I think that's a big thing too. Like we just, as humans, like we don't know that. We just think that like, well, I'm not injured anymore and I'm off crutches, so I should automatically be better. Or it's been 3 months since surgery, I should be cured.
right,
And so having that ability too to one kind of like set realistic expectations, but then two help anything that's an underlying something that their body has been presenting with.
mhm.
Huge, huge, huge for that.
I think that
Um,
and that brings up a whole 'nother can of worms of, like, so often, they go in those instances, they go to doctors and the doctor's like, "Oh, you have pain because of this, so we're gonna do a PRP injection and it'll take your pain away." And
mhm,
it's like, if it doesn't, the person's like, "I don't understand." And it's also like sometimes I feel like, well, like any tool, like anything.
mhm.
Sometimes when the doctor decides the treatment plan, it's not the actual thing that was the driver of the pain anyways.
Yeah.
And then too, like you were saying, when you can't is a PRP injection or is a shockwave like changing tissues? Probably, but when you can't see it and it
Mhm.
takes so long to feel it potentially, and then the feeling of it is not even that reliable of a thing, it's
Yeah.
because then we're getting back into the pain category as like, yeah, I get why it's hard to believe that it's
Mhm.
doing anything and so frustrating. Which always goes back to like going back to like why it's so great to have a tool that can help with the pain and help with the actual like functional limitations that are bothering the person versus the tissue problem.
Oh, 1,000%. I had one patient, gosh, he was suffering for maybe, it had to be a year by then, of pain down in his foot, like excruciating pain, like swelling just out of the blue, and like couldn't explain what happened, just has been there, didn't go away for a year. Went down the route, PT, did all of the things he's supposed to do. He went and had an MRI. MRI showed like possible like inflammation of posterior tib. So, okay, diagnosis posterior tib tendonitis, cortisone injection, no change. And they're like, okay, next step is like exploratory surgery because we don't know what's going on. Oh, yeah, wild, wild. This is like a 35-year-old guy who's active, works out in the field. Yeah. So, exactly. So it was so cool though, because like when you are looking at it and looking at the posterior tib, doing all the testing for posterior tib, you're like, well, it's not really looking like a duck or quacking like a duck. Like, what else can we see that's going on here? Like, just because it shows something on MRI, right? Like, doesn't have to be the driver. And so we went through the LTAP, and it was so cool, so cool. So first part of it was like went through, and he had like a CNS pattern, cleared that, and then his range of motion, because he had like active plantar flexion, he was missing like 50% on the involved side. He gained about just a little bit there, like 5 degrees. Then went through the next round of LTAP, found a neurovascular entrapment down on the top of his foot. Literally skin lift, 30 seconds, whoop, more plantar flexion on the involved side than the other. Like, I've never seen somebody's eyes just get so big out of something crazy, right? And so like worked with him one time a week over maybe 6 weeks, and like he was back surfing, doing everything he wanted to do. Like went on a 4-day hunt where, you know, he's backpacking and rafting and stuff like that.
I love that.
And it was just one of those ones. And again,
didn't have exploratory surgery. Oh
to do what? You know, you're like, what's in the ankle that you would do? I don't know. But yeah, so just one of those things too, not to like knock the medical system or anything, but I think it just brings up the bigger thing of like people that suffer with pain for so long and try all of the things that oftentimes it really is looking through this lens of a neuro-visceral influence of it that can unravel or at least start to turn over some things, which is really cool. And so he obviously is like a wow one, but there's little things every single day that happens. Same thing too, what I find, again, ends up in my office quite a bit is like post-total knee replacements that just no range of motion, like none. And then they're always diagnosed as scar tissue, right? And so then they go under manipulations of anesthesia and stuff like that. And so often, you know, I'm always like, well, did they like do any imaging to see scar tissue? Like, how do you assess scar tissue? It's like, and like your end field doesn't really feel like a scar tissue one. And it's like, once you start like going through the LTAP, there's so many folks with that too, that like once you start following through the sequence and start looking at the central nervous system, start looking at the viscera, you're all of a sudden like, oh, there's an extra 10 to 15 degrees of flexion. Oh, and not cranking on their knee, you know, because it's like all those people walking scared because they're like, I just had someone pushing on my knee and cranking on my knee and forcing my knee for months and months and months, and nothing happens.
So they love when you can get range of motion without touching their knee, because they're like, please don't touch my knee.
Yeah. Like I just had someone put all of their weight on it for months, you know, to no avail. So I think it's really pretty cool.
I think it's awesome too.
And what's even pretty great here about being up in Bend is that we have so many LTAP alums. And so it's a great referral network too, because, you know, there's other folks up here that have a different skill set and even another different lens to come into from massage therapy, from PT and the like, of how they're utilizing it. So it's just a different level with a little different skill set that like building that referral network too of people that again are speaking your language and like they understand where you're looking. And then that way too, it just opens it up a lot more, you know?
Yeah. I love that. You guys do. It is like such a wonderful little microcosm of people in Bend that have taken my course. Like, who would have thought? But I love that because, and you're right. There's like I think every single one is a different type of practitioner,
Mm-hmm.
which is so cool.
Yeah.
So I love that. And I love that you're all collaborating together because that's what it's all about. And and then that's the, I just taught this weekend, and that's like one of the things I said is like the beauty of it, the beauty of the LTAP is, well, there's a lot of beautiful things about the LTAP, but one of the things is like, one, it identifies maybe some practice gaps that you might
Mm-hmm.
have in terms of like, yeah, tools that you don't have that you were like, ooh, this is a little bit of a area that I need support in. So can I find somebody in my community? A lot of times for a lot of people coming from the ortho background, it's like not having a huge central nervous system treatment tool set, for like cranial work or neural manipulation. So having other practitioners in the area that you could speak the same language to, and you can refer and be like, hey, I have this person that keeps coming up central nervous system tension, and we're doing the like basic stuff, but it's not really sticking. Like, can you help me
Mm-hmm.
out here? Like, such a good tool. Um, and then also, yeah, it's just, it is, you have the confident, like, part of it is because it does get you the results. It does build your confidence so that when like, you trust that, yeah, the problem is the central nervous system tension or the visceral thing, like whatever it is. And you're like, I know it's this. So
Mm-hmm.
I'm confident that I can refer to somebody else to help me and get the results for the person. As opposed to, I think sometimes when we're not used to getting really good results, we're not confident that it really is the one thing that they need. And so we're so hesitant to refer them to someone else because it, I think sometimes we think it makes us look bad because you have to admit that you can't, that you need help or like you can't figure it out or something like that. But this way, it's like, no, you're like, no, I know exactly what you need, but I also know I can't do it. So it's like,
Mm-hmm.
here's these people who can. And then they go to that person and get good results. And then your patient's like, oh man, Maria, she knew exactly what I needed. So like, they're going to go back to you.
1,000%.
And I'm
Yep.
like, this is like the coolest thing ever. And so, this is, at the end of the day, a lot of people, especially listening to the podcast, have heard my story. Like, this is actually why I'm so passionate about putting this tool out here, is because I want that level of confidence for a practitioner to be like, if it's not going the way I think it's going, I'm missing something. It might be a red flag, or I might need to refer to somebody else because, like, I don't want them to get in a scenario that my mom was in with her shoulder pain from her lung cancer. That,
Mm-hmm.
when the physical therapy industry is used to getting 60% like success rate as the norm, you know, of course, patients aren't going to get referred back when they have shoulder pain that doesn't get better because that's pretty standard.
Right.
And so it's like, no, I want people to have amazing results all the time. So on the few people that they don't, instead of like thinking that the patient's the problem, they're like,
Mm-hmm.
okay, I know, this is not a normal shoulder then. Like, let's refer it back to the doctor or to someone else, whatever, a visceral practitioner or whatever, and have a better chance of picking things up like that. And also just having a better chance of getting our people back to the things they love, back to the
Like,
surfing, back to the hiking, back to the climbing mountains. Like,
mm-hmm.
nobody wants to be in therapy.
No.
I mean, we're really fun to hang out with, I promise. But also, like, you don't really want to hang out with us all the time. Go outside and do your thing.
Right. And I think that's the biggest thing too, is that getting that part where it's getting that trust to look at it through another lens, and that confidence that people get it. And because they're like, oh, you really do care about me getting better and not stalling out at 60%, or not caring that I just fall off and don't come back for that part of it. It's like, you can see like, yeah, they're invested. Like, they're taking all this time for me to assess and really make sure a plan, and I'm seeing those changes right away. Or enough of being like, they care enough that they're referring me out because they want me to be part of the team and to get better for everything. It's really cool.
Yeah.
Because it's like, I think back to like, working traditional athletic training where, 2 hours before practice, all of a sudden you're bombarded with 20 to 50 people.
Yeah.
And if there was a way to like weed through those triage moments so much faster, huge, huge.
So
And even it's like, gosh, one of the moments that I remember, it was like I was a freshman, so it was my first co-op working football season. And like we had this freshman football player who ice and stim on his back for like the entire season. And it's literally like, gosh, this is my first like introduction as an athletic trainer to the profession. This is this kid's first introduction to like college football and like life as an adult. And I'm just like, we like what other options do we have out there? Like what else can we do rather than kind of like helping to like limp through the season and be like, oh, I could just imagine his shoes of like, is this gonna be the next 4 years? Like
right.
this is my life as an 18-year-old sort of thing. But having ways there, we could be like, quickly assess where to go and try something different because what has been happening hasn't been working.
Right.
It's so powerful.
Yes. I love that. Oh, we're out here just trying to change the healthcare industry. I said this weekend at lunch with the participants. I was like, at the end of the day, like, we were talking about business model of like charging people, and I like, please don't do what I do because I am terrible. I was like, I will treat too many people for free because I just feel bad that they're not getting good care through their insurance or through their team or through whoever. And I was like, I just can't. I was like, and also like, I have a hard time charging a ton of money sometimes because I don't want to not let people get good health care. And I was like, but at the end of the day, that's also why I'm so passionate about getting this to everyone, because if this was more of the standard, people would have better health care. They would have better experiences in the athletic training room. They would have better experiences in a high volume PT clinic. Because where you start matters. Like being able to listen to the body and figure out where the body is protecting can solve so many aches and pains quicker than this biomechanical lens that you're either like putting all your money, all your eggs in the basket of like their foot's driving it, their core's driving it, or like, I don't even know what's popular right now. Everybody thinks is driving it, but so that is just like, yeah, I hate how good medical care costs so much money for people. I don't like that it prices people out that can't afford it. Like everyone should have access to good care. So, which is also why, like, I mean, I love the free, not to plug the missing link, but I love the free missing link week that I do to like have people have a taster of the LTAP online course, because also I'm like, it's free. And it like just knowing the first test of the LTAP, like you said, is a way to triage things so quickly. And so I'm like, yeah, I will continue to do education for free for people because I really, like I said, I want healthcare to be better. I don't want 60% results being good. I want 99% being good.
And I think that's really the biggest thing, right? Is like, if everybody had the same set point of where we're starting and like everybody just kind of came into that lens, then it didn't matter where you would go,
Yeah.
It's just like, who's around the corner? Who's the closest that's there? Because you're going to get the outcome that you need rather than have to, like a lot of the patients I see go through so many different practitioners, and not that they did anything wrong by any means of it. It just wasn't exactly starting in the right place that these folks needed.
Exactly. Love it. Well, I mean, clearly we could talk forever. But before I let you go, I think the last thing that would be helpful is like if someone was on the fence about joining the LTAP level 1, or even just starting with the free missing link, like, what would you tell them to be like, besides just take it, like what are they waiting for, sort of thing. But yeah, what would be your advice for somebody sort of on the fence? And then also, I can't remember, I think you did both the online and the in-person. Yeah. So, and then maybe speak to that too, of the differences between the two and like what.
Oh,
How about
yeah. Yeah, I was fortunate that I did the online first and then did the in-person.
you?
And what I really loved about the online is that you have this cohort that you're going through and you're meeting with for weeks on end there. So you're all mostly at the same starting point with this material, asking questions as a group together, bringing it up and seeing it at like a slow, digestible way that really made like the implementation a lot less scary because of course, like gosh, I've been certified for so long now, right? Like how many continuing education classes that you've been to, and like some of the stuff just comes at you so fast, and like you're all in it, but you don't get time to practice, or you don't want to ask the questions, or the confidence to go through it. That it just ends up with like another certificate that you put in for your CEUs.
Yeah.
That having the fact there where it's broken down, you get the information, you get to ask the questions from you get the support from the people with you, makes it when you go in person, like just connect so many different dots that are there. Because as I was starting to implement, it was maybe probably like 5 or 6 months between finishing the online before going in person. So I had enough time to like start getting reps in and start having my list of questions of like, I'm not sure about this.
Right.
So then when you're in person and you can see it and you can ask you live and then like be there live, you're like, oh, well, that cleared up everything and made that
Right, cleared up all my questions.
nine
But
thousand
you're right,
times
because like if
better.
you had gone in person first, you wouldn't have even known that those were your questions. Like,
Mm-hmm.
it is like people sometimes are like, why is it the same course both? I'm like, because you actually do need that much time to
Mm-hmm.
like fully integrate it and digest it. And I was like, and I promise you, you're once you start doing your patients, questions are going to come up
Mm-hmm.
and the what ifs are going to come up and and I was like, and it's also like, as you said, any con ed course, like people are lucky if they take home two things. And so
Mm-hmm.
it's like, no, I want you to take home all of it. I want you to be
Mm-hmm.
able to feel like you can do it well the whole time. And so it's like, no, in order to be able to do that, we do need this 7 weeks, like you said, makes it digestible so you can practice and work through all the kinks, come up with all the questions, have enough patience, like have enough
Mm-hmm.
reps for it to, have the questions and then also know that you're still in this learning phase. So not get frustrated and just throw it out and be like, I can't get it. I
Mm-hmm.
I think people that happens a lot after Con Ed classes. It's try it a couple times. It doesn't make sense. You can't access the teacher to ask them questions. And so you're just like, ah, fuck, like I'm out.
Right.
So yeah, I love that somebody this weekend said that too. They're like, I'm so glad I did the online first before the in-person. And
Mm-hmm.
um and on the flip side, I have people being like, oh, I love that I did the in-person and like got it in my hands and then had this 7 weeks of the online course afterwards to like, digest it. And the cool thing with the online course is it's lifetime access. So
Oh, huge.
whether you sign up and before and do it or don't do it and then go to in person, and then you can always catch the next cohort anyway. So it's like you can always sandwich it all together. And
Mm-hmm.
so I love that. And I do, I'm like providing people access to me in the community so that they can have that support to integrate it, I think is like so important. And
Oh, it's huge. And it's even sometimes it's just that reassuring part where you're like, oh yeah, no, your thought process is right. Like sometimes you just need that like little bit there to be like, oh yeah, no, you got the concept
yeah.
aspect of it. So I think like if you're on the fence, I think the biggest takeaway that I had that really came apparent once I was in it is that like it just made every tool that I was using, because like you always say, you have everything you already need for treatment and for tools and for all of that stuff, that it's not another technique to use. It's just like starting in the right place. So it makes everything that you're already doing, you just are speeding things up along in the timeline.
Yeah. I love that. Thank you.
Yeah, thank you.
Well, yeah, I've loved having you on here. It's been great to talk to you. I love having you in the community. How can my people find you on the socials if they'd like to connect and ask you questions about either how you are, doing your private practice as an athletic trainer or using Shockwave and laser or the LTAP in your practice or
Yeah.
patients who want to come see you?
Sure. So I'm at Remedy Sports Med on Instagram, and then remedysportsmedicine.com for my website.
Love it. And we'll link that. We'll have Joe link that in the show notes too. But yeah, love it. Thank you so much.
Thank you. And go Ducks, huh?
Yes. And go Ducks. Always go Ducks.